Hi, everyone. My name is Parthasarathy, and today I'm excited to talk to you about how a technique from business called systems thinking is not just changing how we think about biology, but also has the potential to revolutionize global health as well. So a little bit about me. My name is Parthasarathy, and I'm a rising senior from California with an interest at the intersection of biology and technology. My curiosity in systems thinking for global health stemmed from an internship I had with NASA, where I learned to apply systems thinking frameworks to astro and space biology. I've also looked at robotic applications for biology as well. So let's dive right in. Systems thinking is a paradigm originally used in business management to streamline complex organizational problems into simple cause and effect feedback loops. More recently, systems thinking has been applied to biology with 5 key aspects differentiating this new approach from the original reductionist biological thinking. One of these aspects, the most important one, is the notion of a network of networks. For example, the organ systems in the human body go beyond individual aspects like cells and tissues to model more complex interactions and nested systems like an exquisite jigsaw puzzle where individual pieces interlock to form the bigger picture. The other 4 aspects are the extensive use of computational and mathematical modeling, cross-disciplinary application, a bottoms-up approach, and a holistic thinking viewpoint. Building on the idea of a network of networks is the theory of systems archetypes, summarized in a 2003 research paper by Dr. E.F. Wolstenholme. In his seminal paper, Wolstenholme claimed that all global problems can be generalized into 4 patterns or archetypes, just 4 causal loops: underachievement, out of control, relative achievement, and relative control. While I won't be able to go into depth on all of these archetypes today, I am going to explore the out of control archetype in particular. The out-of-control loop, as the name suggests, intends to control a situation, but instead worsens the problem. This type of a loop is common in business management. A company intends to reduce bad media coverage by holding a press conference, but unintentionally increases their bad media coverage at the press conference. The good news, all of these 2-loop archetypes, including the out-of-control system, have a solution archetype, and here it is to establish a direct link with news sources to better the media output. Now, let us see how this same out-of-control loop can be used to demonstrate the versatile application of systems thinking to biology, specifically in understanding cancer. To avoid increased cell growth, cells perform apoptosis, or cell death. A mutation in cell apoptosis causes mutated or abnormal cells that continue to stimulate mitosis, forming a tumor, completing this out-of-control loop. The solution link, shown here in blue, is to develop processes to silence abnormal or mutated cells, and that is exactly what current cancer treatment is accomplishing. Of course, the implementation in the real world is far more complex. Our 2-loop cancer archetype can be swapped for a more complex network of interactions, as shown here on the slide. But if you squint a little bit, you can see at the core of all of this complexity is still the simple archetype that we saw before. Now, let us focus on how systems thinking can help define the foundation for new global innovation in healthcare. The World Health Organization has been advocating for such systems thinking applications over the past few years, specifically highlighting systems thinking's ability to identify potential risks and circumstances for error, as well as the interests of the end user as key attributes to developing better healthcare processes. Here's a great example of the power of these systems thinking attributes being applied to global health. This systems thinking network for immunization of children in sub-Saharan Africa unifies multiple systems archetypes into a network of networks. Even though this is a complicated system, I want to break this down by drawing your attention to 5 key places. 1, how the network tracks the spread of COVID-19 cases. 2, the availability of PPE. 3, the transmission of COVID and the risks involved. 4, the impact on the economy. And 5, the availability of vaccines to increase immunization. So you can see how countries like South Africa or Zambia were able to use such systems thinking frameworks to take a holistic approach to such a complicated problem to have a dramatic impact in their fight against the pandemic. Here's another example, one of my favorites, of how Ghana and Rwanda use systems thinking to counter the global pandemic. Using systems thinking, these countries were able to identify the risks involved in delivering COVID PPE to remote parts of the country. Interestingly, the solution archetype that these countries adopted involved a partnership with Zipline, an autonomous drone company. The use of these large-scale drone delivery networks has been one of the key factors that has allowed these countries to drastically reduce COVID cases and COVID-related deaths. But these are not the only occurrences. Across the world and over again, systems thinking has been significantly beneficial in addressing multiple public health and humanitarian efforts. China has relied on systems thinking approaches over the past decade to develop better healthcare systems in rural villages as part of projects to bring healthcare finances to developing parts of the country. Researchers in Pakistan use computational modeling and large-scale tree networks to chronicle human advice-seeking behavior of primary healthcare physicians for measles and tuberculosis. Northern Bangladesh has used systems thinking to create more holistic, sustainable visions for maternal and pediatric care. And in South Africa, the use of systems thinking has helped train the next generation of public health leaders. So how can we get involved? We can begin by applying a more holistic, bottoms-up viewpoint towards global health challenges. We can work with members of public policy, government, medicine, and science to address such challenges. And we can breed the next generation of technological innovations by means of computational analyses. As the next pioneers and leaders in global health, we can shift the lens by which we view healthcare and public policy. And we can do it all starting with a small two-loop system. Here are some of the sources that I used. And I would like to thank the Johns Hopkins Global Health Leaders Conference for giving me a platform to present today. I would like to thank my family and my mentors for all their support, and you, the audience, for your time. I've attached my contact information below if anyone is interested in sending their questions. Thank you so much.